Yeah.
Next speaker, please.
Yeah. Dr. Peush Bajpai, he is head of the department, Delhi, basically, Manipal
Yeah.
Hospitals.
So I hope I'm audible clearly.
Yeah, slides are
Yeah.
visible and audible.
Yeah. So my presentation is on Pacific real world study. The treatment duration and interim analysis of progression-free survival was presented for this real world study in this ESMO Congress. So we all know this Pacific study was there, and which did show that durvalumab given in stage 3 NSCLC non-resectable who were treated with concurrent chemoradiation, durvalumab given with a placebo control was a comparator. So there we did see that 5-year overall survival was improved over there, and progression-free survival again was there. So PFS was nearly 16 months in the updated, 17 months nearly in the updated analysis versus placebo of 5.6 months. So this has almost become the standard after this presentation of this trial. However, real-world studies have their importance because uh, whether the results of the trial are translated into real-world practice, that is very important. So this was basically the extended access program which was available. And this study was done between September 2017 and December 2018. Up to December 2018, at least the patient who were enrolled, and they were stage 3 NSCLC who received chemoradiation, and regardless of the tumor PDL1 expression. So they got durvalumab 10 milligram per kg every 2 weekly, the trial protocol. And they were actually analyzed. So the data presented over here was PFS events. Nearly 1,400 patients were included, and 290 active sites with 11 participating countries were there. So again, the primary investigator, SSPFS and OS were the primary endpoints. Talking about the patient characteristics, well, we see that the age less than 75 was nearly 89%. And then stage 3A, if you see over here, was nearly 43%, slightly lesser than what was there in the trial. The histological subtype was adenocarcinoma predominantly in 63%, and PDL1 expression more than 1% was there in nearly 72% patients. Now, one thing important over here was median time to durvalumab initiation was 56 days. So this is more than the usual 6-week time as per the protocol. So the median durvalumab treatment duration was nearly 11 months, and patient received a median of 22 durvalumab infusions. So talking about median follow-up duration in this PFS analysis was nearly 23 months. And what was seen was that the median PFS turned out to be 21.7 months, which was actually higher than the actual trial. So this is, of course, analysis in the real world setting, and biases could be there. So definitely, this could be the one factor because of biases. We could see the slightly increased PFS, but the PFS was definitely higher in PDL1, more than 1% in subgroup analysis. In stage 3A, the PFS was higher. It went up to 23.7 months as compared to 19.2 months in stage 3B and C. Chemo radiation concurrent, again, the PFS was higher as compared to the sequential. And of course, adenocarcinoma, again, non-squamous histology, PFS was higher as compared to squamous. So nearly 16.7% patients actually discontinued the treatment because of any adverse effect. 47% completed the actual planned treatment. And the cause of discontinuation was again pneumonitis as the most common cause in uh, nearly 18% of the patients, where moderate event was nearly 8.4%. Uh, this particular real-world study demonstrated that the consolidation durvalumab after chemoradiation for a median duration of 11 to 12 months, 11 months over here, is effective in large real-world cohort of patients with unresectable stage 3 NSCLC. The median real-world PFS turned out to be higher, 21.7 months, as compared to the trial. And challenges with collecting real-world PFS data limit comparisons between the real-world and the actual trial. So the effectiveness of durvalumab after chemoradiation in the analyzed subgroups were generally consistent with the previous specific trial, including the PDL1 subgroups. And rates of treatment discontinuation due to adverse effects, 16.7%, were definitely higher, and disease progression were consistent with what was seen in the Pacific trial. Pneumonitis and ILD events were manageable, and 70% nearly actually got steroids. So they were manageable and mostly moderate in the severity, which was actually seen in the Pacific trial. Thank you.
Very interesting, Dr. Piyush. I can have a few queries.
Yes, sir.
Your personal practice cost insurance, how does it look like in durvalumab? The data appears to be fairly interesting in the real world.
I think so. It's a good option looking at the PFS, grim PFS of stage 3B, 3C, where most of the times we give chemoradiation. So it is an important option that we have. Of course, looking at the survival in such small curative edge that we get, I think so. It is worthwhile, sir, to give this to our patient as a option.
Affordable in your setup? They take it?
That, of course, is a challenge, sir.
Okay.
And especially when we talk about pneumonitis and also definitely that becomes a challenge.
Okay.
Yes.
Thank you. Thank you.